It is Physio Week 2020, and for Throwback Thursday, the Johannesburg Metro District decided to ask the past 5 years of community service physiotherapists about their experiences, and this is what they had to say.
My name is Cleo.
My name is Kristen Allen.
Lauren Holmes.
Moluko Mantata.
My name is Mohammed Belli.
I worked at Shovila Clinic as well as Mofolo Clinic.
I worked at Alexandra CHC.
I was working at Lenasia Clinic and Lenasia South Clinic. I was between the two.
Joburg Metro was my first choice.
I applied at all the big 5 hospitals and I was really hoping to get better. Am I mad that I got second rounded? No, because I think Zola became a place I'll always call home. I think I learned so much working there and it's grown me in a number of ways. I think I've taken the principles I've learned there and I've applied it to everything I've done thereafter.
So funny story, I was actually applied to Para where I'm working now at the moment. That was my first choice as Facility 3. Johannesburg Metro was my second choice. I didn't know much about it at the time, but I knew that it was in the Joburg region, which is why I chose it as well.
I was born on the side. Unfortunately, I wanted to work at a clinic where I was born at, which is like a clinic, but there's no actually rehab services that side, so I had to choose nearby clinics, which was more full, and so on.
Working in the community is unlike any other environment. It's a good learning environment. You have a lot of creative freedom working in the community. You're able to start campaigns, you're able to treat your patients outside of the clinic, you're able to reach out to your patients, and clinically you learn a lot because anything comes through the door. So you really develop a lot of confidence treating patients in the community.
In community, it's really important for a physio to be adaptable.
When you're in university, you focus a lot on hospital work, learning your clinical skills as well. But coming into the clinics, I learned more about how learning interpersonal relationships with other colleagues, MDT members as well. As a physio, I could explore more of the public health aspect of it.
It encapsulates the essence of public health, and I think that a lot of people have a misconception about what public health really is. And it combines every single facet of physiotherapy, and I think that's what I love so much about it.
You don't have a lot of resources, so you have to think out of the box and you have to use what you have in relation to the patient.
I think my favorite outreach was aquatic therapy. We were able to do low impact exercises, a lot of strengthening, stretching for them, and they loved the social interaction. The patients loved the water.
By the way, I had a few swimming lessons from Motabi.
I loved outreach. I loved not being in the clinic. I loved going out and making a difference in the community.
Firstly, coming into the Joburg Metro, I didn't expect to do so many campaigns. I thought it was just an OPD setting where you would see patients, but we did ECI campaigns, so just working with children, educating caregivers, educating teachers of schools and crashes as well. You can find the link between how we can provide physical intervention as a physio, but also provide education.
We do a lot of groups here, which is really great, and the community loves it. Everything that you do, they back you up 100%.
At Alexandra Clinic, there's a great group environment.
Just the participation. When patients come and they don't really progress on a personal level because they feel very on their own and more concentrate on their pain. But when they see people that are or have the similar condition to them or are feeling the similar pain, just seeing how they can progress together as a group and with the participation was something that I thought was really beneficial.
In terms of MDT work, you don't really interact much with the other disciplines when you're in varsity. And I found that working as an MDT, you're able to give a more holistic treatment to the patients that you're seeing.
The great thing about working in community is that there's such a big team and you're really able to address the patient's needs on every single level. MDT became the highlight of every PEDS case that walked in, every adult neuro case that walked in. I worked very closely with the speech therapist who was at Zola with us, as well as the OT. And I think it was just so nice to draw inspiration from the different disciplines. I learned how to make hand splints in my Comm or something I never thought I'd be able to learn.
In the clinic level, I didn't know what a speech therapist does, to be honest. Just learning how they treat patients and what conditions they actually see was something that opened my eyes up as a physio, and just working together to try and combat the patient in one session.
So Physio Week is a lot of fun and a lot of work. We had a very big campaign. We were looking at 500 people. Everything went wonderfully. We had a theme which was movement. We did a lot of exercise groups, walking. We addressed schools. We addressed just general community members, and the community was there every step of the way. The community really assisted us in every way. They gave us a stadium to work with, they supplied us with porta potties, a whole bunch of resources. People really do come out to support you, and I think just from that point that was overwhelming.
Physio Week was probably the best highlight for me of 2019.
Coming into Comm, so from a student environment, you're not exposed to campaigns at all. And having 4 full days of campaign all the way around Joburg, from the north to the south, east to the west, it was a lot of hard work, but it was so fun.
Physio Week is always stressful. I think there's so much planning that goes behind it, and the build up to it is stressful, but once the week pulls together, I think everything just flows so nicely, and it's nice to see everyone pull together as a team.
I think the most surprising thing about working in community is that you learn a lot of skills that are not hands-on. So I've learned how to plan a campaign, how to manage a campaign, how to run a clinic.
There's actually so much you can do at a PhD level without having all the equipment and other colleagues and staff or supervisors at a hospital level.
You're expected to do more than you think you should be doing.
The amount of managerial skills that I learned, or things that I had to take into consideration besides just treatment of a patient.
Time management is a big one. You really do learn to manage time and your resources.
Being adaptable in situations.
I call it crisis management now in hindsight, but it was learning how to manage the diary. I think initially that was very overwhelming for me because there's always a waiting list, and I didn't know how and when and what time and how I was going to see everybody. But I think sometimes you just need to step back and take a breath and think of alternate solutions, and I think it's something that I've literally carried with me throughout.
Okay, first, leadership.
I learned a lot of managerial skills which help me now in my current job as well.
I definitely think community helps to build you in ways you can't even imagine. You learn so much about the community.
The skills you learn here are skills that you won't learn in any hospital. In public health, you literally get to experience every single facet of physiotherapy, and you get to learn at your own pace as well.
You have to think about out of the box. There's no resources like your academic hospitals. We have to actually use what we have.
Coming from a hospital, where does it end? Where do patients fall through cracks? And this is where our job, and at the Johannesburg Metro level, this is where your role can really be accommodating, because you can now animate patients, you can teach them about things that they wouldn't necessarily learn in a hospital. The role and the importance of getting them back to what they were doing before is the best role that you can find in the primary health.